Hello students. So today we are going to learn a new topic, human nutrition. Usually we learn in human nutrition about the human digestive system, the digestive glands, physiology of digestion and the disorders of your nutrition or because of nutrition. But presently in this part we are only going to learn about human nutrition, the introductory part and in detail about the nutritional disorder. You can see the content, that is in nutritional disorder we are going to learn about Kwashiorkor's disease, Marasmus, indigestion, constipation, diarrhea, jaundice and vomiting. Okay. Now, as I always keep the first slide with relation to the topic. So here you can see on the left part, you can see different vegetables, fruits, right, which is necessary for our body to get lot of vitamins, minerals, fibers, etc. Towards the right top, you can see a small animation image on which the wording says eat healthy, feel healthy and look healthy. That is, if you have healthy foods you will be feeling healthy, and if you are feeling healthy then you will be looking healthy. Because if you don't eat healthy foods, automatically our health will be affected. If our health will be affected, our body will be affected. That is vice versa what you are reading out, right? Similarly, on the right lower half we can see a time clock, right? But in the time clock it shows different foods which you have to consume throughout the day or every time, so that our body system is healthy. Okay. Now, moving on to the next slide, just as I told, initially I kept some of the interesting aspect about the nutrition. So here, nutrients are the essential for the normal functioning of human body. That is what we define a nutrient, right? So what is necessary for human body? Carbohydrates, proteins, fats and lipids, vitamins, minerals, water. So all these things are required. Maybe certain things may be required in larger quantity, certain things in a lesser quantity, but it should be in a proper amount. That is, as we use the term balanced diet. Okay, so you can see various food as we read out: the carbohydrate, protein, fats and lipids, vitamins, minerals, which we see around in the images. Then again one pie chart, or we can say pizza chart, where you can see towards the left top fruits and vegetables which is necessary, lower meat, fish, egg, beans and other non-dairy source of proteins which is also required. Then towards the center, food and drinks high in fat and sugar, then which should be consumed less. You can see the pie chart or the pizza chart where you can see the proportion which you have to eat. That's why you can see the proportion accordingly. I repeat it: fruits and vegetable to a maximum proportion. Maybe if you say out of 100%, it should be almost around 30%. Then 10% meat, fish, egg, beans. Less than 10% food, drinks high in fat and sugar or sugar. Then again towards the top, bread, rice, potato, pasta and other starchy food also almost around 30%. Then milk and dairy products almost around 20%. So which gives us a proper balanced diet. Okay, so here another very important slide where you can see the animation itself is self-explanatory. Towards the left, doctor catching an apple. What does that mean, or what does that say? An apple a day keeps a doctor away. The old saying, correct? And towards the right, you can see fruits, vegetables, which is there, which nowadays we have to consume in the form of tablet, right? If you are not having in proper proportion. Also now you can see the chart where different vitamins are required for the betterment of the health, bones get sufficient vitamins and minerals. Otherwise we have to take it in the tablet form. If you take all the required fruits and vegetables in proper amount, all the vitamins will be present in our body, whether it is A, B, B1, B2, B3, B4, B6, B12 or vitamin C, vitamin D, vitamin E, vitamin K or other minerals. Now, see the food pyramid, what is required. Again, if you see the food pyramid from basal part to the top part, or other way around from top to bottom, what is required more in amount, what it is in lesser amount. If you take from top to bottom, limited intake of red meat and butter, limited high glycerin foods which should be taken in very less amount. Why? Because if these things are taken in high amount, our body digestive system may be affected, the metabolism may be affected, the organs load will be there on the functioning of the organs, so again it can be affected in a longer span of time. Then secondly, low fat dairy and soya milk, multiple vitamins for most of them, which now, as I just showed in the previous slide, we are instead of having natural fruits and vegetables, we are consuming vitamin tablets more often, right? Then further, water 5 to 8 glasses in a day, or if you take the proper proportion, it should be 3 to 4 liters in a day. Also towards the right, egg, fish, poultry and plant proteins, which is also required 1 to 2 servings in a day. Then next, legumes 1 to 2 servings. Then nuts, seeds and which are also required 1 to 2 servings, right? Then whole grains 4 to 8 servings. Similarly, towards the right end, plant oils 2 to 4 servings. And again at the lower basal region, vegetables 3 to 6, which has got all the nutrient, minerals and most important fibers for proper metabolism and digestion, along with the fruits, which may be also 2 to 4 servings. Last but not the least, the daily exercise and weight control, because whatever food you are having, digestion is necessary, and for proper digestion our body system should work properly, and for that purpose daily exercise is also required, so that our weight will be controlled, the digestive system functioning will be proper. Okay, now coming to the main introductory part of it, it is about nutrition. First point, nutrition is the sum of the process by which an organism consumes and utilizes food substances. Just as you saw in the second slide, what is nutrition, right? So here we have got a proper definition. The sum means the total of the process by which an organism consumes and utilizes the food substance. Then WHO, that is World Health Organization, defines nutrition as the intake of food considered in relation to the body dietary needs. That is, what amount of food is required according to our dietary needs, right? Further, the dietary needs of a healthy human being include carbohydrate, proteins, fats, vitamins, minerals, water and fibers in adequate amounts. That's what we learned in the third slide. These are the important things required in the body. But as I mentioned, it may be in a proper proportion, which is required slightly more, which is required slightly less, or in a moderate proportion. Further, the term nutrition includes the processes like ingestion, digestion, absorption, assimilation and digestion. So these are the important process which takes place with relation to the digestion part, or which relation to taking in of food, which is ingestion. Then digestion, what we take in should be digested. After digestion, proper absorption into the body, blood, cells. Further assimilation, that is into the cells as formation of cytoplasm, protoplasm takes place, and digestion, that is unwanted undigested food has to be expelled out of the body through digestion. Here in the previous topic which I had taken, that is excretion, I had used this term as well. Excretion and digestion both are different terms, right? Digestion only means removal of undigested waste matter from the body, but excretion means it's not only removal of undigested food matter, but along with the nitrogenous matter, that is in case of humans, mammals, it is urea. Okay, so that is a major difference between digestion and excretion. Further, food provides energy and organic material for growth and tissue repair. So if you have proper food, it gives us energy to do all our regular work, right? And organic material which helps for the growth, tissue repair, for overall immune system, right? Further, vitamin and minerals are also required in small quantities for nutrition. Now, unlike carbohydrate, fats, proteins, vitamins and minerals are required in a small proportion according to the particular vitamin, because anything in excess or less can cause various disease or disorder, which are going to learn in the later part of the topic, right? So it should be in a proper proportion. Then the food that is consumed needs to be processed before it is utilized, means it has to be properly cooked, processed, then we can consume it. Further, digestion. Now, what is the definition for digestion? The process by which the complex, non-diffusible and non-absorbable food substance are converted into simple, diffusible and assimilable substances. Now, in simple word, if you go or learn the terms complex to simple form, non-diffusible to diffusible form, non-absorbable to absorbable form, that is assimilable. That is, as I told in the earlier part of the topic, or in the fourth point, as you can see the term ingestion, digestion, absorption, assimilation. That is, these component, whatever we eat in the nutritious food, this has to be absorbed into the body. That is very much important, right? So complex, non-diffusible and non-absorbed food has to be converted first, that is by the process of digestion, into simple, diffusible and assimilable substances. Okay, towards the left you can see a bodybuilder, but if you see carefully, it is a bodybuilder by all different fruits and vegetables, which builds our body naturally. Okay, then further, why nutrition? What is the requirement? When if you ask a question, what does it do? It helps in growth and development, specifically the children, that the growth, which helps them to have a healthy body, to for the development of the body and to build their immune system. As if you take the example of a present stage, all of you in a growing stage where your height starts to grow, body starts to develop, your bones become stronger, right? So these are only because of a healthy nutritional diet. Further, improves immunity. As I mentioned, in the present scenario, as you know, immunity is an important factor. If you have got good immunity, any bacterial infection or viral infection you can overcome. If you are weak, immediately the bacteria or viral infection can affect your body, right? Then detoxification means removal of toxic substances from the body. Again, it is only because of good nutrition. Then anti-aging, if you're having proper food and diet, it increase your lifespan. If I just add an example over here, if you have seen our grandparents, they are quite healthy, right? Why? Because our grandparents, great grandparents, they are still there 90 years, 95 years, 98 years, 100 years as well, right? Why? Because they were having natural food, vegetables, fruits, etc. Present day, what we are having, junk food, right? So this all junk food, oily food, sugar aerated drinks, these are only damaging our immune system. Okay. Further, increases energy levels and vitality, means our energy level is always maintained if we are having proper diet, proper nutritional diet or balanced food. Okay. Now, moving further, now as we just had the earlier slides about the nutrition, what should we have, what is required, all those things. Now we come to the major part of the topic, that is the nutritional disorder. Okay, now here nutritional disorder and disorders of digestive system. Nutritional related disorders can be categorized based on the food that an adult or that an individual consumes, and conditions that develop due to malfunctioning of the organs or glands associated with the digestive system. So if your food is proper, then there is no issue. As we read in the previous slide, we will be healthy, our immune system will be strong. But if you are not having proper diet, of our diet does not include proper food, then what happens? Then our body functioning stops, or there will be malfunctioning of the organs, glands, etc. There will be either less secretion or over secretion. So that has to be taken care if our diet is not proper. Then also little extra or less of nutrition can lead to dietary disorder. That means what? If your that's as I mentioned, if your nutrition has got less amount of dietary food or extra, both can lead to any disorder. Here if I give a small example, very best example which you can understand, all of you like sugar, sweet, right? But if you are having more and more of sweet, what will it happen? It may cause diabetes. Now diabetes is a disorder. It will not happen in one day or 1 week or 1 month or even 1 year. It is a slow process. It may take 5 to 6 years to happen. Why? Slow and steady our system becomes weaker and weaker and weaker, and finally maybe around 5 to 6 years our body system will become so weak, our pancreas does not secrete insulin, which will lead to diabetes. And then we have to depend on medicine, insulin. As we can see, some of them has to be dependent on medicines or insulin because of diabetic condition. Or if you have salt more, right? If salt is red, we don't eat, we don't like to eat. But if salt is more in the food, sometimes we like more salty spicy food, right? Usually all the junk food, packaged food has got lot of salt. So if you are having excess of food, it will lead to what? High blood pressure, right? Or if your food is more with fatty substances, obesity, high cholesterol, again then it will lead from one disease to another disease, right? So these are things which are to be in proper proportion, neither less or more. Then further, inadequate intake of proteins can cause protein energy malnutrition, which is in short PEM, right? Protein energy malnutrition, which you are going to learn in the further slide. It can be associated with inadequacy of vitamins and minerals in the diet. So along with protein, even lack of vitamins and proteins can also affect our body system. Further, PM can cause disease like Kwashiorkor and Marasmus. So major protein disorder is Kwashiorkor and Marasmus. What are both and what is the difference? Also we are going to learn further. In the left side you can see child holding a bowl, how early nutritional disorder affects the children if they are only having one type of food, correct? Not vegetables, fruits, etc. Then towards the right, main nutritional disorder which is usually seen: obesity, starvation, which we can see in many very different countries where there is a lot of poverty. You can see starvation, which may further lead to Kwashiorkor, Marasmus, further anorexia nervosa, bulimia nervosa, vitamin deficiency, trace element deficiency, right? So further in the chapter we are going to learn about all these deficiencies. Now we take one by one. Kwashiorkor. Now see the image. By seeing the image, you may feel very bad, sad, right? Now those who are getting proper food, proper diet, we don't respect that food. Mother might be cooking very delicious foods at home, but we happen to eat from outside, the junk food more often, right? See here, the children's in the poorer country where they don't get sufficient food, they got various disease and disorders, right? So here I just put a small image because by seeing the image you may feel very sad, right? So these images itself shows that how the lack of protein can cause various symptoms or disorders like Kwashiorkor. So now we take the points one by one. The protein deficiency disorder is found generally in children between 1 to 3 years of age. You can imagine 1 to 3 years of age, early ages itself it may get affected. Children suffering from Kwashiorkor are underweight, as you can see in the image, and show stunted growth. The height may be affected. Poor brain development, loss of appetite, because once they have that habit, then anything they will not feel like eating anything. The appetite is lost. Anemia, protruding belly, which you can see in the right side of the image, slender legs, again which is the effect of the Kwashiorkors, bulging eyes, edema of the lower legs, and face, change in the skin and hair colors. These are the different effects of Kwashiorkor, which you can see in the image. In the image also you can see the different disorders because of Kwashiorkor, that is hair changes, miserable expression, moon face, thin muscle, fat presence, skin change, edema, usually underweight. Even on the right side in the image you can see protruding belly, brownish hair, dark and scaly skin, stunted growth, underweight, swollen legs, loss of appetite, anemia, mental retardation, reduced resistance. See the so many symptoms just because of kwashiorkor or lack of protein deficiency. Now, next, marasmus. Marasmus again similar to kwashiorkor protein deficiency, but what is a small difference? Now, again, if you see the image from the previous one, the children's from 1 to 3 years they have got protruding belly, right? But here if you see, again you feel very sad by seeing the kids not getting proper food. You can see the skin are not, even the skin is there, fat layers not present, the bones, ribs are clearly seen, right? Now you can take the point one by one. It is a prolonged protein energy malnutrition, again that is PEM, is found in infants under 1 year of age. Now we can see the difference in kwashiorkor marasmus. Both are because of protein, but kwashiorkor between 1 to 3 and the marasmus is less than 1 year, or we can use the term infant, correct? In this disease, protein deficiency is coupled with lower total food caloric value, means there is no calories in their food, which even if they are getting it, which will be less calorie food. Inadequate diet impairs physical growth, which you can see, retards mental development, subcutaneous fat disappears, that's why they are looking very skinny. Ribs becomes prominent, which again it is very clear in the picture. Limbs become thin, skin becomes dry, thin and wrinkled, loss of weight, digestion, absorption of food completely stops, or it stops partially due to atrophy of digestive gland. Means the digestive system itself stops functioning because continuously there's no food availability, no digestion takes place, or no proper intake of food. It further leads to atrophy of the digestive glands. There is no edema. In case of kwashiorkor, edema is present. The further major cause of these disorders is unavailability of nutritious food, poverty, large family size, ill spacing of children. So what does that mean? Means sometimes what happens, the children's there will be no gap of 2 or 3 years, maybe less than 2 years, less than 1.5 years, or maybe just around 1 years. In that case, the child born immediately after the next one may not get proper food, no proper diet, proper milk, because of which the this can be a reason for marasmus. Then again here, for the further point, ill spacing of children, early termination of breastfeeding and over diluted milk are few causes. As I told, if there is a less than the gap period is less than 1.5 years, 1 year, etc., the child will not get proper milk. Because of malnutrition, infectious disease become opportunistic and worsens the condition. And in such case, what will happen? The children are caused with infectious disease. Well, proper diet can help in reverse of symptoms. So it can be improved or improvised with proper food. Okay. Now you can see both the image, left side image and right side image, which in the right you can see again this different symptoms. Hair may be normal, the gross muscle wasting, there is no muscles will be there, underweight, then you can see no fat under the skin, okay, and face which is like a old man, because the face there will be a lot of wrinkles, which in no fat underneath. Now I just put a table also to understand the difference, as you already saw in the paragraph, but still this will make it easier, right, as a differentiate between kwashiorkor and marasmus. So in kwashiorkor, it develops in children whose diets are deficiency of protein. So here protein deficiency is there, as it is common for both. In marasmus, along with protein deficiency, it is also calorie deficiency in the diet. Second, it occurs in children between 6 months and 3 years of age. So as we read, 6 months or 1 year, 1 to 3 years of age. But in marasmus, it is common in infants under 1 year of age. Subcutaneous fat is preserved. So as you saw in the image, subcutaneous fat is present in Kwashiorkor. But in case of marasmus, the subcutaneous fat is not preserved. Oedema is present, oedema is absent. Enlarged fatty liver, no fatty liver. Ribs are not very prominent, ribs are prominent in marasmus. Lethargic, alert and irritable. Muscle wasting, mild or absent, which are absent, but in severe muscle wasting, that is only you can see the difference very clearly in the image. Poor appetite, voracious feeder. Because of lack of food, sometimes they become voracious feeder. The person suffering from Kwashiorkor needs adequate amount of protein. In case of marasmus, again the person suffering marasmus needs adequate amount of proteins, also fats and carbohydrates also. That is food rich in calories. Clear? So this difference help us to understand the both distinguishing characteristic. Also, if you are seeing image of both Kwashiorkor marasmus, these points are very clear from those images. Further, indigestion. Now this is because of what? Taking in food but not properly, or having something too much unnecessary, overeating, all those things. So we go by the point one by one. Overeating, which is very common sometimes when you go to marriages, functions, right? Inadequate enzyme secretion, spicy food, anxiety caused, can cause discomfort and various symptoms. It is called indigestion. So indigestion, now most of them will be familiar with because of having excessive food, spicy food, which is very common. Improperly digested food or food poisoning also can cause indigestion. So if the food is not cooked properly or not digested properly, or if the food stock is old, or food poisoning may happen because of old stock of food, etc., or something mixed in the food, which can cause indigestion. It leads to loss of appetite, acidity, which is acid reflux. Now this acid reflux you can see onto the right side of the animation image. What is acid reflux as such? Heartburn, regurgitation, or we can use simple term vomiting, dyspepsia, or upper abdominal pain, stomach pain, which is again common because of indigestion. Further, what can be done? Avoiding eating large meals. So instead of having a large meal, have little bit which is sufficient, which is required according to your diet. Lying down after meals, so you should never lie down, go to bed immediately after meal. Have a little bit of walk so that the digestion takes place. At least half an hour to 1 hour's gap minimum should be there after the meal. So you can have walking around, which helps in digestion. Avoid spicy food, oily food, junk food, which are more common reason for indigestion. Smoking, alcohol, the other reason, are the preventive measures for indigestion. So in the left side image you can see cause of indigestion: overeating, heavy eating or fast eating, excessive alcohol intake, caffeine, that is lot of intake of coffee or tea, carbonated or fizzy drinks, that is aerated drinks, Pepsi, Cola, Coke, Thumbs Up, anything if you take in excess, right? Smoking, spicy, fatty or greasy food, poor sleep hygiene. So this also sometimes if you are prone to seeing mobiles, addicted to videos, movies, late night keeping awake, because of all these things can have uh, can say proper sleep will be not there, because of which we can use this particular term proper sleep hygiene, because the health get affected because of it. Anxiety or depression, pregnancy, sedentary lifestyle. What is sedentary means? Doing work almost entire day by sitting at one place, lack of movement, exercise of the body. Then certain medicines, even certain medicines can cause the reason. Okay, and as I told, right side you can see the image where you can see the acid reflux, or also we can add to it the vomiting or regurgitation. Okay, then fourth, constipation. This also sometimes it is one of the common problems which arise. What is the reason? When frequency of defecation, there is removing of the feces, expel of the feces from the body is reduced due to less than once per week, the condition is called as constipation. Okay, difficulty in defecation may result in abdominal pain, distortion, rarely perforation. The causes are affected colonic mobility. Why? Due to neurological dysfunction, that is if there is a spinal injury, sometimes your food, as you are having lot of junk food, so which may not have any fiber, so low fiber diet, inadequate fluid intake, that is water, or best any fruit juices, natural one, not the preserved one or preservative one, right? The natural fruits or even vegetables, etc. So even that fluid intake also affects. Or inactivity means exercise, moving around, walking, if it is not there. So these are some of the reasons. Roughage, sufficient fluid in the diet, exercise can help the condition. What is roughage? Or if I use it in fibers, if you are having lot of fruits, vegetables, leafy vegetables, it has got lot of fibers and roughage, which helps your bowel movement. Bowel movement is very much important for digestion. If your digestion is good, your bowel movement is good. If you have movement with the bowel or pain during the bowel movement, then it indicates there is some problem with the digestive system. Okay, sufficient fluid, as well water intake 3 to 4 liters in a day, or having natural fruits and vegetables which has got lot of fluid in it, like watermelon or cucurbita, etc., can help improve conditions. Okay, so I put a simple image over here. Here also I put a image related to diarrhea. What are the reasons of diarrhea? Passing loose watery stools more than 3 times a day is called diarrhea. Now this can be said opposite to constipation, right? Diarrhea can lead to dehydration. The other symptoms are blood in the stool, nausea, bloating, fever, depending on cause and severity of the disorder. So because of diarrhea, there can be because of excess, the lot of water is lost through the body, that is dehydration takes place, and sometimes blood also can be seen in the stool, that is in the feces. The cause of diarrhea is what? Infection through food and water. As I told, if you are when you are having indigestion, what is the reason? Excessive intake of food, right? Salty food, spicy food. So it can also lead to diarrhea. So it can be because of food or that is infection in the food or food poisoning. And water or disorders like ulcer, colitis, inflammation of the intestine, or irritable bowel syndrome. Okay, just as I told you, your bowel movement is good, that means your digestion is good. Further, that is jaundice. Now jaundice, first you see the image, you can see same person, the image, left side healthy skin color, right side jaundice. If it is jaundice, whites of the eye turns yellow, skin also turns yellow in color. So body becomes yellowish in case of jaundice, which is one of the best way to identify a person with jaundice or with the particular disorder, right? Now we can go into the detail of it. We all associate jaundice with yellowness of the yellowness of conjunctiva of eyes and skin and whitish stool as well, right? These are the symptoms of condition called as jaundice. It is a sign of abnormal bilirubin metabolism and excretion. That is, if bilirubin, which is secreted from the liver, if there is an excess secretion or abnormal secretion, it can lead to this particular disorder. And it can be seen in the excretory system also, that is when you are secreting the feces or in the urine, etc. Jaundice develops if excessive breakdown of RBCs, red blood cells, placed along with increased bilirubin level than the liver can handle, or there is obstruction in the flow of bile from liver to duodenum. Bilirubin produced from breakdown of hemoglobin is either water soluble or fat soluble. Fat soluble bilirubin is toxic to brain cells also. Hence serum bilirubin values have great diagnostic importance. There is no specific treatment to jaundice, but supportive care, proper rest are the treatments given to the patient. So in case of jaundice, there is no specific treatment, but proper care, proper rest, proper food can help to treat jaundice. Then next, that is vomiting. Now, in this condition, the stomach contents are thrown out of the mouth due to reverse peristalsis movement of the gastric wall. Right? That again can be various reasons. It is controlled by non-vital vomiting center of the medulla. It is typically associated with nauseatic feeling. So the nausea comes during vomiting. Again, the reasons of vomiting, as we learned earlier, in case of indigestion or in case of diarrhea, which may relate with the excessive eating of food, regurgitation, or more what do you say, acidic content in the food, spicy, oily. Sometimes this can also lead to vomiting. Okay. Again, I have put up a simple picture of vomiting to understand the condition. Okay. Now, little bit of additional things other than the seven disease and disorders of nutrition. Do you know alcoholism causes different disorders of liver like steatosis, or we can say in simple word fatty liver, alcoholic hepatitis, fibrosis and cirrhosis, or as we come across the term liver cirrhosis. This can happen because of what? Alcoholism, right? So if you see onto the left, liver disease, you can see the condition of the liver. In case of hepatitis, how the liver looks. In case of liver steatosis, how the liver appears. Liver cirrhosis, you can see how the liver condition is. Or alcoholic hepatitis, in case of alcoholic, you can see the difference, how it is swollen up. Or fibrosis liver, or liver cancer. So see the difference in the liver condition. So whenever the scan of liver is done, because the appearance of this liver itself can help the doctor to understand what kind of liver disease it is. Also towards the right, you can see what are the other effects of alcohol in the body, right? Firstly, increased cancer risk in the oral cavity, larynx, throat. Then fatty liver, liver cirrhosis, shrink liver, liver cancer, which already are seen in the left side of the image. Then overweight, mucosal inflammation, that is gastritis. What is gastritis? Inflammation in the gastric gland or the stomach. Pancreatitis, again inflammation in the pancreas. Esophageal cancer, stomach cancer, colon cancer, beer belly, that is, you can say even protruding belly. Then bloated skin, muscle damage, gynecomastia, or towards the right from the top, memory loss, lack of concentration, depression, phobias, Korsakoff syndrome, or further hypertension, heart failure, arrhythmia, cardio myopathies, or erection problem, or impotency, or numbness in the nerves, damage to the nerve tracts, Wernicke's encephalopathy. So these are the various other disorders other than the liver disorder. Now, again the second last slide here, know the scientist. So always the do you know what are the additional importance, all this I am adding here, so it helps us to learn all these interesting facts and findings. So here Kamla Soni was the first Indian woman to receive PhD. Right, so it's really amazing to know that first PhD or Indian woman who got PhD was Kamla Soni in science discipline. She worked under the guidance of Dr. Robert Hill, and now Robert Hill you are familiar with, right, and discovered cytochrome C, the electron carrier in the mitochondria from potato. So Robert Hill, when you learn the chapter respiration, always the name of the scientist Robert Hill come across. So here we also know that now about Kamla Soni, who discovered cytochrome C along with Robert Hill. Dr. Soni also worked on nutritional aspect of legumes, milk and nira. Her contribution was significant in terms of India's fight against malnutrition. She had designed a protocol for array dairy to avoid curding of milk. Again, other than this also she has done a lot of work. Again, a little bit more information I had added to it. Kamla Soni from 1912 to 1998, biochemist. Kamla Soni was first Indian woman to get a PhD in scientific discipline. She struggled repeatedly against gender-based discrimination to earn her degrees. As you know, in the earlier stages, there's always discrimination, men and women, right? The women were not allowed to go out of the house, do anything, study. All these factors were there, which most of you know about it, right? But still, she earned a degree, PhD degree from Cambridge University in UK, right? It's really appreciable. She returned to India in 1939 and was appointed as professor and head of biochemistry department at Lady Hardinge Medical College in New Delhi. Also, there is one more image. Kamla Soni, first Indian woman to get a PhD in scientific discipline. She paved the way for women to get admission at ISC. So she was the reason where other women started to go to colleges, started to get admission in the IASC, that's Institute of Science. Now, assignment question based on the today's part. Okay, so thank you all of you.